infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. And a topic that has not received nearly enough attention, Hepatitis A. We're going to discuss that today. Why? Well, since 2016, the United States has seen the largest person-to-person Hepatitis A virus outbreak in the post-vaccine era. About two-thirds of the states have declared outbreaks, which includes tens of thousands of cases, with about 6 out of 10 people ending up in the hospital, and more than 300 fatalities. Now in Kansas, which is the most recent state to declare an outbreak, the hospitalization rate stands at 88%. Now in my home state of Florida, one of the states that have been hit the hardest, while the outbreak cases are trending downward, we're still seeing dozens of cases reported on a monthly basis. So joining me today to discuss hepatitis A in the highly effective vaccine is practicing physician, vaccine researcher, and Vice President and Director of Scientific Affairs and Public Health for Vaccines at Glaxo SmithKline, Dr. Leonard Friedland. Dr. Friedland, welcome back to the show, sir.
Well, thank you very much for having me.
You're welcome.
It's a really important topic, and I'm glad you're interested.
I sure am. Well, let's go ahead and just give the audience a primer on hepatitis A. So what is hepatitis A? The disease, the transmission, and how does it differ from hepatitis B and C?
Yeah, that's great. So hepatitis means inflammation of the liver. And there are a number of viruses that can cause inflammation of the liver, and they include hepatitis A virus, hepatitis B virus, and hepatitis C virus. And there are important differences across all of these hepatitis viruses, A, B, and C, while they all affect the liver, and they all can cause, really severe illness and even death. They're actually transmitted in different ways, and they all have a different course of illness. And, let's focus in on hepatitis A because that's how you started. And it's very, very important because we're having outbreaks across many different states here in the United States and very high rates of hospitalization. And so when people present with hepatitis A, it can come on gradually. And people may not understand what's happening right away when they have this illness. They can present with fever, abdominal pain, vomiting, diarrhea, joint aches, yellowness color to the eyes and the skin. And it's only over time that many people start to not feel any better. They can get worse. They can get dehydrated, present to the hospital or the doctor's office for care. And we're seeing very high rates of hospitalization, 60% rates of hospitalization. Some of these outbreaks have recently had more than 80% people being hospitalized. That's a really, really high percentage of people being hospitalized from this illness. And unfortunately, we're seeing, some deaths as well. And so and the good news is that this disease is vaccine preventable. And that's why we really want to make sure that people understand that there are vaccines available that can help protect against an illness that is causing morbidity and death in the United States. And again, it's vaccine preventable.
And like I said in the intro, the United States is reporting the largest person-to-person hepatitis A outbreak in the post-vaccine era. Dr. Friedland, what's been going on in the past few years, and who is this outbreak affecting the most?
Right. So there was a consistent downward trend for more than 20 years in the number of cases of hepatitis A in the United States. But beginning at around 2017, just about 3 or so years ago, hepatitis A cases have really been increasing and spiking nationwide. We've had 29 states now that have had active outbreaks of hepatitis A right now in 2020. And this can increase the risk of transmission as well. Now, this disease, this virus is spread from person to person with contact. It could be contaminated food or drink, and it's the fecal-oral route of transmission. So this virus can be on contaminated food or drink. Somebody touches it with their hands. It gets into their GI tract through they're eating it, they're touching their mouth, and then it travels through the GI tract and it can be shed in the stool. And that's a transmission cycle. And we're seeing these outbreaks that are occurring from this type of transmission. And a lot of these outbreaks have been associated now with unstable housing conditions related to homelessness and other unsanitary conditions. And so it's really, really important that people understand that this vaccine, this disease caused by this virus can be prevented through vaccination. And again, because we're having increasing numbers of outbreaks, more people being hospitalized and people dying, it's really important that we raise awareness of this. You may not be aware, but while hepatitis A vaccines are available for adults in the United States for quite a while, I think the numbers are something like 15% of people have received one dose of the hepatitis A vaccine and only 9% of the second dose of the hepatitis A vaccine, and it's a 2-dose series. So it's really important that we raise awareness, and thanks for talking about that today.
Right. And let me get back to the outbreak, though, because, I mean, historically, we think of hepatitis A as generally a mild illness. So what's going on with the high hospitalizations and the fatalities that we're seeing? What's different?
Well, yeah. Well, hepatitis A can be a mild illness, and it can also be a very, very serious illness. And we've had more than 30,000 reported cases of hepatitis A since 2017 states. And over 60% of those people have been hospitalized with more than 300 deaths. This disease can cause significant issues, including dehydration due to vomiting, and that's what will often bring people into the hospital, and it can get worse. And, essentially anybody who's not been vaccinated is at risk from this disease. We've seen foodborne outbreaks that can occur all along the food chain. So it could be when somebody's eating a fresh piece of food, fruit, or other foods that we eat fresh. The virus can be transmitted all throughout the food chain from the time that the food is picked to when it's processed. It can survive even the freezing situation, and then it can be when it's being prepared and served. And so that's very, very important. And we're seeing that in recent times when we've had unstable housing conditions, many people homeless, that's a risk factor as well for many of the outbreaks. And because deaths can occur, and in the numbers of cases are increasing, we're seeing more of these cases here all across the United States. And that's why, it's really important that people speak to their healthcare provider, their pharmacist, or their doctor to see if have received the hepatitis A vaccine, and if not, to ask to find out more information about that and to get themselves vaccinated.
Yeah, and I believe there's been at least a small percentage of co-infections amongst these outbreaks also with hepatitis A, with B and or C.
Yes, some of the risk factors are similar across the various viruses, the hepatitis viruses, and that's why it's important to also make sure that you're up to date with your hepatitis B vaccine schedule. There is no vaccine to protect against hepatitis C, which can be spread through blood exposure. So it's important that people speak to their doctors around risk factors for hepatitis C as well.
Dr. Friedland, how is hepatitis A diagnosed? Is there a laboratory procedure for this? Yeah,
so there is. Initially, the first step in getting a diagnosis is having the healthcare provider have suspicion that the signs and symptoms that a patient is showing up for a presentation to their doctor, those signs and symptoms with fever, nausea, vomiting, light-colored stool, dark-colored urine, joint aches, yellowness of the eyes or skin, if they suspect a hepatitis as the cause, they can do a blood test, absolutely, to make the diagnosis.
And before we dive into the vaccines, is there any specific treatment for hepatitis A? There is now specific treatments for hepatitis C. How about A?
It's a very good question. So there are very specific treatments now using antiviral agents for both hepatitis B and also for hepatitis C. Mm-hmm. For hepatitis A, there is no specific treatment for hepatitis A. And so basically the best treatment for hepatitis A is to avoid getting the infection to start with, and that would be through vaccination. Otherwise, the treatment is going to be symptomatic to help somebody get through the illness, but occasionally it can get worse.
Yeah, and as we've talked about, as you peppered in throughout some of your answers, that there is a prevention in the form of a highly effective vaccine, which arrived on the scene, I think, in 1995. Dr. Friedland, can you talk to the effectiveness and the safety of the hepatitis A vaccines?
Absolutely. So hepatitis A vaccines have been available for quite a while here in the United States. I've been judged to be safe and highly effective. Hepatitis A vaccines are a 2-dose vaccine. For adults, the second dose is given 6 months after the first dose, and the second dose is what provides the long-term protection. And these vaccines, the good news is that they're covered by most health insurance plans because they're recommended for use by the Centers for Disease Control. But despite their being covered by most health insurance plans and they're being recommended for any adults who wants to be vaccinated to protect against hepatitis A, we've only seen about 15% of all adults in the United States have received that first dose in the 2-dose series, and only 9% have completed the second dose series. So it's really important that we essentially raise awareness so that people understand what the options are and can go ahead if they choose to get vaccinated to protect against this particular illness. I should also let you know that there's a combination hepatitis A and hepatitis B vaccine, and that particular vaccine is a 3-dose series, meaning there's 3 doses to complete the series with the combined hepatitis A and B. Mm-hmm. The hepatitis A vaccine, just to restate, is a 2-dose vaccine where the second dose is given 6 months after the first dose. And that vaccine can be given in the doctor's office and also in the pharmacy. And pharmacy is a great option for people who may not have an appointment to go see their doctor, but certainly we're in retail drug chain pharmacies very, very frequently. And so definitely this can be done safely and effectively in the pharmacy as well.
Yeah, is the trade name for that Twinrix?
So the combined hepatitis A and B vaccine, the name of that vaccine is called Twinrix. Yeah. And I should say that vaccine is a vaccine that is marketed by Glaxo SmithKline, which is the company that I work for.
Right. Now, if I go back a few years when I was a much younger man, the hepatitis A vaccine was primarily advised if you were traveling to certain countries. That's not true so much today, right? Because things have changed. There's a lot more high-risk groups, so the vaccine is really being recommended to a larger swath of people.
Yes. So hepatitis A vaccines, hepatitis A disease can be associated with travel, particularly with unsanitary water, and so the food can be contaminated in various parts of the world. We also say that people who are adventurous eaters may have an increased exposure to hepatitis A, and we tend to be adventurous when we travel with trying local foods, and particularly from street cars, etc. And so hepatitis A is one of the vaccines preventable diseases that are often recommended for people who are traveling. You know, I should say, though, that we have seen foodborne outbreaks of hepatitis A here in the United States, be it with fresh or frozen foods. And although while we're today not eating out as much in restaurants, given the COVID-19 pandemic, we certainly are ordering in food as well. But that is not the only risk factor. Other risk factors for hepatitis A include people who have unstable housing situations, for example. People with underlying chronic medical conditions are at increased risk for hepatitis A, and including anybody who is interested in protecting themselves against hepatitis A. Mm-hmm. And so it's really, it's not to be associated only with foodborne outbreaks any longer. Basically, we're all potentially at risk for hepatitis A because of the way the virus is spread from person to person through hand-to-mouth contamination, contaminated food or drink. And so it's recommended that we all speak to our healthcare providers around hepatitis A vaccination.
Very good. Now, Dr. Friedland, is there anyone that should not receive the vaccine series because of contraindications?
Well, for any vaccine, yes, for any vaccine, there's always a very small risk of having an allergic reaction to any of the components of the vaccine, or if you've had an adverse reaction after the first dose of the vaccine. So in those situations, if you've had an adverse, like a severe allergic reaction after the first dose, or you know you're allergic to any of the components of the vaccine, that would be a reason to not receive hepatitis A vaccination. But those situations are quite unusual. And so it's always important when you ask to be receiving recommended vaccines, you have a discussion with the healthcare provider to make sure that it's appropriate to be given to you. But outside of that, the answer is that the vaccines are generally very safe and effective. And that's why it's really important that we speak to our physicians and pharmacists about hepatitis A, also the nurses that we work with. But if I may add, that it's also important when we're having discussions around vaccination for adults that we also ask about what other vaccines are recommended for a person of my age. And so for adults, the vaccines that are routinely recommended include a vaccination for what we call Tdap, it's tetanus, diphtheria, and pertussis vaccination. For people over 65, vaccination for pneumonia with the Streptococcus pneumonia vaccines. Of course, influenza vaccines every year for everybody in the United States above the age of 6 months. And also for adults, the shingles vaccine, which is recommended for all people over the age of 50. And it's important to have these discussions to make sure that we can provide the maximum protection against vaccine-preventable diseases for adults. And this is even increasingly important now during the COVID-19 pandemic. We have seen dramatic declines in vaccination rates for people of all ages, including adults, during the pandemic, which is really not surprising because we weren't going to the doctor's office to have our routine checkups. We weren't going into the pharmacies at the same type of frequency that we were in the past. And office visits and other healthcare visits dramatically declined during the pandemic, and that directly translated into lower rates of vaccination for pneumonia, for shingles, for hepatitis A in adults. And it's really important that we make sure that we're completely up to date with all the recommended vaccines, including now, of course, influenza, as we're in influenza season, because we don't want to have other outbreaks of disease on top of what we're already dealing with the current pandemic.
Yeah, that's some great advice. And let me go ahead and close with this, and I just want to get your thoughts on this. With the current COVID-19 pandemic going on, during the course of 2020, do you suspect that the total number of hepatitis A cases reported this year is probably underreported because the exact reasons you just said, people aren't going to see their healthcare provider as much?
Well, that's a really interesting and important topic. Now, of course, I can only speak to the number of cases that have been reported by the Centers for Disease Control and the Departments of Health that have resulted in increased hospitalizations and deaths. As mentioned, we've had more than 30,000 reported cases, and over 60% of those have been hospitalized. But the COVID pandemic, has absolutely impacted the delivery of healthcare in so many ways. As I just mentioned, immunization rates have dropped significantly during the pandemic. Just to give you some numbers, upwards of 83% drops in adult vaccination rates during the pandemic. Another risk factor that we didn't speak about hepatitis A is also hepatitis A can be associated with drug use, either injection drug use or preparing drugs for use. And we've seen rising rates of drug use during the pandemic as well. And so that's an ever also increasing risk factor. And so my suspicion is that the number of cases that are being reported is underrepresented. But we can speak to, what we know, which is more than 30,000 reported cases. And this is why, during the pandemic, the Centers for Disease Control, your state and local health departments have been strongly encouraging that people of all ages, including adults, go and make sure that they're completely up to date with all of the recommended vaccines. And the big focus right now is on influenza vaccination because we don't want to have influenza added on top of COVID and potentially overwhelm our healthcare systems with sick individuals with respiratory illnesses. But we also don't want to have people, presenting to their hospital with hepatitis A, which results in upwards of 60%, if not higher, rates of hospitalization. It's also important to mention, because you may say, okay, well, that's great, but is it safe for me to go to the doctor's office and get a vaccine? Is it safe for me to go to the hospital to get a vaccine? Is it safe for me to go to the pharmacy and get a vaccine? And the answer is absolutely yes. Mm-hmm. The healthcare system in the United States, physician offices, hospital settings, and pharmacies have all set up extremely safe environments for people to be safely receive routine medical care and vaccination. It's pretty amazing what's been happening. Doctors' offices have set up times where they'll only have healthy people come in at a certain part of the day to receive vaccinations and routine care, and anybody who has any signs or symptoms of any illness, they'll be seen at a different time of the day. People will often be asked to wait outside in their car or somewhere else and then be called in just for their visit. And pharmacies have, really gone above and beyond to create safe environments for delivery of healthcare in the pharmacy setting with unidirectional traffic flow through the pharmacy settings with vaccinations in separate parts of the pharmacy, outdoors as well, in parking lots, and it's pretty remarkable the level of how safe and effective it can be to receive routine medical care, including vaccinations, during the pandemic. And that's why we should always take advantage to have discussions with our healthcare providers, which include pharmacists, to make sure that we're completely up to date with all of the routine medical care that's recommended at our particular age, and that would include vaccination. And I would, because we're talking about hepatitis today, ask about hepatitis A vaccination as well, because we're seeing outbreaks now in more than 29 states currently here in the United States. This virus is highly transmissible from person to person, and it's highly effective with safe and effective hepatitis A vaccination, which is recommended. And it's just really important to know about this. By the way, besides what we're talking about today, there's a really excellent website that people can access, and it's at the Centers for Disease Control. They have fantastic information there about what is hepatitis A, B, and C for that matter as well, and all the things we've been talking about today, recognition of disease, and also prevention through vaccination. And the CDC website specifically is cdc.gov/hepatitis. HEPATITIS, cdc.gov/hepatitis.
Absolutely. I'll go ahead and link to that in the show notes when I publish the podcast. And excellent discussion. And I want to thank you, Dr. Leonard Friedland, for sharing your time and your expertise on hepatitis A and the vaccination. I really appreciate it.
Well, thank you very much. And stay safe and take advantage of the tools we have to keep ourselves healthy, and that would include vaccination for all of the adult recommended vaccines in the United States. And just to sum up, I think as we continue to be managing our way through the pandemic, and there's certainly lots of hope on the horizon with vaccines and therapeutics, we have to continue with our what we call non-pharmacological interventions. So we have to keep with social distancing, wearing masks, washing our hands carefully. And then on top of that, we should be doing everything we can to keep ourselves healthy, and that would include vaccination against the vaccine-preventable diseases that are recommended for adults, which also includes hepatitis A.
Again, more great advice. Thank you, Dr. Friedland.
Have a great day. Thank you.